An ounce of prevention is worth a pound of cure. This is true. There are a lot of advices how to improve our physical health, preventing the disease by taking care of what we do and what we eat. But what about the mental health? What is that ounce of prevention when it comes to mental health? And do we take enough care of that? Our region was recently shocked with an event that happened in Serbia when a young teenage boy killed his 9 classmates at school. A horrible tragedy that rendered all of us silent for days. In a matter of 24 hours from a school tragedy, another mass murder happened in our region. A young 21-year-old man killing his 8 neighbors. For all of us in this region, those events raised questions of firearms control and mental health issues, which are unfortunately still in good measure a taboo with a dose of stigma in our societies. According to the World Health Organization, 50% of all the mental disorders begin before the age of 14 and 75% by the mid-20s. Most of them remain unrecognized and untreated. Some say that the rejection, misunderstanding and discrimination associated with the mental health stigmas can be harder to deal with than the condition itself. Stigmas and myths about the mental health reduce the possibility that they will seek help, but also that the help and support they need will be provided timely. Parents, teachers, even some medical workers do not have sufficient training when it comes to certain mental health issues, let alone the prevention. And let's not forget the shortage of mental health experts, especially for children and youngsters, an issue our region is struggling with. It is estimated that 9 million children and young people in Europe live with some of the mental disorders. Yeah, unfortunately, needs are always bigger than means, but only around 2% of national health budgets go to the mental health. So, how much do we invest in the mental health of our youth, our future? I will not talk about advices to you what to do for your own child's mental health. But I would like to open a discussion about what can be done at institutional level, especially can we do anything at the regional one? Like policies to be established, good practices based on the good experience from other countries that would be systematic, all-encompassing and lifelong. A study from 2020 shows that around 22% of adolescents from Albania, North Macedonia and Kosovo reported symptoms of depression. The research presented by the National Youth Council of Serbia end of last year shows that more than half of young people had symptoms of depression. The 2022 research in Bosnia and Herzegovina revealed that the most prevalent diagnoses or the difficulties for the adolescents are depression and anxiety. 48% of them report this. Almost 40% of young people in Montenegro feel under stress every day. Us at the RCC, we made some first steps toward bringing together the youth mental health needs and the policy solutions as from December 2021 within one of our Youth Lab mental health initiative. From that moment, young people from the region with decision makers are working on their national mental health plans, instructions and recommendations. But we should be proactive, yes, we know that, more open and free to communicate about the mental health, especially with the youngsters from this region. Everyone, children and young persons in particular, have the right to timely support, protection and mental health care, and it is the responsibility of adults to enable it. I know, as I said, budgetary constrictions are an issue, but clearing up many gray areas when it comes to mental health legislation and improving intersectoral approach are a must if we want to have a clear picture of one of the biggest problems that this region is facing. Friendly environment as well is a necessity when speaking about these issues. Communities are changing. Our kids and our children do not consider the only community they are living with their home and their families, but there is an online community as well. Do we really have any regulation? Well, it's a rhetorical question because I know that it's quite hard to find any legislation that really regulates the use of online media or social media platforms where our children, the youngsters, the kids are always bound to. Some professions as well in the region needs to be regulated. Some others need to be recognized. There are a lot of practitioners working in here who are trying to help people with mental problems problems or different episodes of depression or anxiety to cope with. But at the very end, are you really sure that the right and the good ones are the ones who are offering this kind of services, or in between them there are others offering their services when it comes to counseling? So there are a lot of issues that stand around the mental health in this region. First thing to help yourself, it's not to become a victim, and then not to accept that it's only you are a bystander on what is happening with your life or with the life of one of your loved ones. Yeah, I know that it's easier said than done, but we need to convince ourselves that when it comes to mental health, an apple a day doesn't keep the doctor away.